Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just tuning in, we are talking about GUAM SORES, and ExpressCare's Dr. Jitka Lom is here, ready to answer our viewers' questions. All right, Doc, our first viewer is asking, of course, and we touched on this earlier, is it contagious?
They are really contagious. The bacteria are there, can spread from person to person, particularly when there's close contact. Another place that happens is at the gym.
All right, now, does it have to, just an extension of this question, but does the other person have to have some sort of open wound or something for them to contract GUAM SORES?
They do. They need to have a small scratch or a little tiny break in the skin.
Yeah. Okay. Now, our next viewer is asking, what is MRSA?
Yeah, we pronounce it MRSA, MRSA, Methicillin-Resistant Staph. Okay, it's a bacteria that is very resistant to many antibiotics. You know, over the years, using antibiotics over and over and over, we've developed this very resistant strain, okay, which is a little bit prevalent here on Guam. And the reason that it's more dangerous is that we just have fewer choices of antibiotics to kill it with. So if you have that particular strain, we really want you to finish your 10 days of antibiotics and really use something called Hibiclens. It's in a little green bottle, it comes out pink, and you use that to fumigate your body. It's like a body wash. You can use it in the shower to kill all the germs on your body so that it doesn't spread to others. Because MRSA can be quite dangerous, especially for diabetics and people who are otherwise unhealthy.
All right. Now our next viewer is asking, how can you get rid of it?
Well, it's actually pretty easy to get rid of. That's the beauty of it. When you understand, okay, this is a staph bacterial infection, it's on your body, it's on the sores, and it's on the hairs, especially in your nostrils, then you just need to kill it from the inside with antibiotics, kill it from the outside with your Hibiclens or body wash and warm water and soap, and also put some antibiotic ointment inside your nostrils to destroy the reservoir that you've got inside your nose. So quite often I explain that to people and they seem surprised that they could be carriers of a bacteria in their nostrils, but it's extremely common here.
All right. Now our next viewer says, my child has had GUAM SORES, and although it is gone, it has left really bad scars.
Yes.
How do I deal with the scars?
It's very unfortunate, and I see adults sometimes who've had such terrible sores in their childhood that they do have permanent scarring. So first of all, you never want to get it to that point. You want to treat your child, get them on antibiotics, teach them how to wash their skin with soap and water, and help them not scratch, cut their nails so that they're not digging, because it's the digging that creates the scarring. Once you already have the scars, you can help heal them with a product called Mederma. You can buy it over the counter at the pharmacy. It's a cream that you can put on many, many times a day, and protecting the skin from the sun. But even with all of that, sometimes people will have a residual scar.
All right, now an extension of this, my grandmother, I had a relative who did have GUAM SORES, and so she would always put on those tights, over the scars, I guess, to prevent scratching. Now, is that recommended, or does that?
The moisturizing is really important, and sometimes wearing tights keeps your skin a little bit more moist. I think mostly it's a cosmetic thing where people are covering up. Exposing the skin to a little bit of sunlight, of course, is very healthy. So I'm not sure if she was covering it or trying to heal it, but once the scars are there, the best thing you can do is just keep moisturizing it, use the Mederma, and try not to scratch anymore.
All right. Now, do you have any final comments, Doc?
A common reason people get GUAM SORES is with insect bites, especially if children are outside playing in the grass and they'll get red ant bites or sand fleas or whatever. So if you notice that an insect bite has occurred, just put a little bit of over-the-counter hydrocortisone on that. That will reduce the itch, and then you won't scratch. And then make sure you clip your child's fingernails so they're not dirty and so they don't get an infection or a GUAM sore. And if you do have one in the family, make sure you treat everybody in the family, especially their nostrils. Make sure that everybody has a clean nose and put the antibiotic ointment inside so that the infection doesn't spread.
All right. Now, I just have one last question. Now, they call it GUAM SORES. Why do they call it GUAM Guam sores? Like,
I don't know why they call it. It could be saipan sores too. It could be sores anywhere. But the medical name is impetigo. But I think people have noticed that when they're in a tropical environment, this type of infection is much more common, and I think that's where the name might have come from.
All right, okay, thank you so much, Doc. Now, if you have a topic that you want us to cover, email us at healthyliving@kuam.com. We'll be back to wrap up the show.